All right, everyone. We are group one, and we are going to discuss mental health treatments effects on substance abuse disorders. So what we have researched is that there is a lack of education, providers, as well as resources. Those are significant barriers to forming successful treatment plans for those with both mental health and substance abuse disorders that are co-occurring together. Research was analyzed and synthesized on how mental health treatment could be beneficial in decreasing the substance abuse disorders prevalence that co-occurs with mental health disorders. So the significance of the problem, according to the Healthy People 2030, we found that a substantial amount of treatment was available for those with substance abuse problems, but most people do not actually accept any form of therapy along with substance abuse. Mental health is another problem where there are many forms of treatment, but most do not accept any form of treatment as well. Per the report, more than 20 million people have a substance use disorder in the United States. Based on this knowledge of those not accepting the treatment, we became interested in mental health disorders and co-occurring substance abuse disorders. Society needs to become aware of preventative measures used to help decrease the instances of co-occurring disorders.
With that being said, we came up with our PICO question for this research topic. And the PICO question entailed for adults with mental health disorders, will mental health treatment decrease the incidence of substance abuse disorders compared to those without treatment by 2030? We used the Johns Hopkins evidence-based nursing practice model with help in this research, and we used it because it's a tool that utilizes help to disseminate our research findings, and we used it to continue researching topics and evaluate evidence in order to provide necessary education on topics lacking this research, such as ours.
And then to help find the best articles, we used a bunch of different databases such as like Midline, PubMed. We also utilized the Texas Women's Library Research Tool in order to find peer-reviewed scientific articles. Research terms such as like mental health disorders, substance abuse disorders, mental health treatment, substance abuse treatment, lower substance abuse rates, and addiction. And those were all used in order to kind of narrow our search down to get articles that were the best match for the topic that we were doing. And then we further narrowed that down. Once you search those topics, a lot of articles pop up. And so to get those best ones, we used terms such as and or in order to get articles that either were like mental health treatment and substance abuse, or you could search substance abuse or mental health treatment, substance abuse treatment, or mental health in order to find those articles that had not only substance abuse, but also mental health disorders, and then further to get articles that included like treatment for substance abuse, as well as treatment for mental health disorders, to try to get all those articles together with that information on how treatment helps with substance abuse, and then if there were those comorbid mental health disorders. And then we also used, like I said, the peer-reviewed articles that were pertinent to our PICO question in order to get the best ones that we could. And then we also excluded all articles that were older than 5 years and those with no substance use abuse or mental health disorders that were in it. That way we had the most relevant information for research and for our appraisal.
So throughout most of our research, and I'll be talking about the analysis of literature, we found that substance abuse and mental health disorders are closely related. There are some common themes with it, meaning there's some co-occurring disorders, such as self-treating. And self-treatment means, for example, if there was someone who had a mental health issue, such as depression, they would treat with illicit drugs or even marijuana or alcohol. They would treat with some form of substance to cope with their mental health disorder. A lot of unmet treatment needs or potentially misdiagnosed individuals were at higher risk for fatal events. Prevention, we discovered prevention is key. Treating or diagnosing disorders early can prevent chronic lifelong illnesses. For example, one of the research shows that a reduced number of symptoms and substance use when participants are thoroughly treated. multiple barriers occurred, such as societal stigmas, lack of trained providers, lack of community resources, especially in rural or poverty-stricken areas. So it did show that there was a clear connection between mental health disorders and lack of medical treatments, and an increase in substance abuse disorders. Per the National Institute of Drug Abuse, half of the people with mental illness will have a substance use disorder at some point in their life. So that was a common theme that we found throughout our research in all of the articles that we used.
So based on the data review, there is a great deal of evidence that supports practice change. Recommended changes would include providing tailored, patient-specific, and holistic mental health treatment for those with substance abuse disorders or mental health disorders. Treatment should be comprehensive, including pharmacological and psychotherapeutic approaches. It should also be developmentally age appropriate. Clinicians should understand that these conditions impact one another and can lead to worse outcomes than either disorder alone. Therefore, there should be a focus on diagnosing and treating co-occurring substance abuse and mental health disorders. There should be a push to prioritize mental health services in areas that are underserved in order to help reduce opioid use and overdose risk. Since behaviors seen in depression, anxiety, and ADHD can often mimic behaviors of substance abuse disorders, we should be assessing for signs and risk factors of mental illness early on in childhood and adolescence before substance abuse becomes an issue. There should also be more support to overcome barriers, such as societal stigmas. Dissemination would include providing early life mental health assessments and screenings during doctor's visits, providing those with mental health disorders or substance use disorders, facilities that offer treatment or therapy that can be individualized, helping to treat co-occurring disorders. There should be better education for providers on treating co-occurring disorders, and there should be better access to resources in rural and underserved communities. Evaluation of progress should be surveys for those receiving treatment or therapy to evaluate whether treatment and therapy are beneficial. Likewise, we should also establish competencies for practitioners who provide treatment for mental health and/or substance abuse. And that concludes our presentation. Thank you for watching.